you are here now. Let's start our today's session, female reproductive health. To make it more clear and make that to understand you, I have created one PPT. So I'm going to share the PPT with you guys. Okay. It is visible?
Yes.
Okay.
Yes, ma'am.
Great. So just a quick recap, what is important for us to understand when we are talking about female reproductive health. So very, very important is understanding the pelvis. So when we're talking about reproductive organs, so reproductive organs are staying inside the pelvic region. So this is the pelvis region where the organs are staying into the pelvic cavity. This is a differentiation between the male and female organs. So you can understand uterus is there in a female body and uterus is not present in male. So there are three organs which is present in our body, that is a bladder with the urethra, uterus with the vaginal canal, and rectum with the anal canal. But in male body, there is two organs which is lying there. So one is a bladder and then there's a rectum. So they don't have the midline or middle organ, uterus. So they don't need vagina also. So you can see that why they have only two openings, and one is for this penis and one is for anus, and we have a three openings because we have a different organs lying reproductive system organs where reproduction is going to happen. Reproduction, body is going to reproduce something like ourselves. So we can generate a baby, we can develop a baby, and we can produce a baby. So this is our production. And this is because of the reproductive organ. They also have a sexual organ that is a prostate, and their prostate is lying with the urethra. So just beneath the bladder, the prostate is there in a male body. And then behind the bladder and this prostate and urethra, they have the rectum and anal canal. And this wide spanned muscle, which you can see on the sides, is the pelvic floor muscle, which is very, very important muscle. So you can understand that whenever we are in standing position, this muscle, there are two things. The muscle is providing the support. So of all the organ which is lying, so it has a main important function. This is the main important function of the pelvic floor, providing the support of the pelvic organs. And second important function of this muscle is that through the middle of this muscle, to the center of this muscle, the canals are passing. So there are two canals which is passing in a male, and there are three canals they are passing in a female body. So around the canals, muscles are wrapped around, and muscle is going to work as a sphincteric action, opening and closing action. So this muscle wrapped very beautifully around the urethra, and whenever you want to hold the urine, muscles compressors will come into picture, and they will create a compression effect and contraction effect, and they will help us in making this continence. Actually, we will not leak the urine because of the pelvic floor muscles. The people who leaks, most of the time their pelvic floor is not supported, that they have a weak pelvic floor. They don't have enough strength and power and endurance into the pelvic floor. That's why the contraction ability of the pelvic floor is not there. That's why they are not able to hold the urine, and urine leakage is there. Same way, some females, they might have a tightness of the pelvic floor around the urethra, and if the muscles are tight, they will not let the urine go outside. So they might have difficulty in passing the urine or emptying of the bladder. So muscles has an important sphincteric role, opening and closing role whenever we require. Same way, we have a vagina, and muscle is wrapped around the vagina. And if you want to insert something inside the vagina, like during the penetration of your finger, gynecological examination, or the sexual activity, we really want to go inside. So once you want to go inside, we want relaxed pelvic floor at that time. We don't want any kind of tightness down there. If the tightness will be there, there will be no penetration, or might be difficulty into penetration, which can give pain to the female. So pain is, again, it's not a good sign. So pain will be the symptom of a patient. and it will be hard for the penetration. If the penetration will not happen, so assume a girl who really want to get pregnant, but if the penetration of the penis will not be there, then the sperm can't go inside the vagina. And if there is no ejaculation inside the vagina, there will be no reproduction. It means the sperm cannot go towards the uterus. So female can't get pregnant. So tight pelvic floor and spasmodic pelvic floor can create a female infertility issue in a female, because the sperm cannot go inside the vagina and they can't move towards the fallopian tubes. So because there's no penetration, no intercourse. Same way, when we want anything to go outside from the vagina, so we don't want this pelvic floor muscles to be tight. Like during the childbirth, when the baby is developing inside the uterus, and after that baby has to come outside during the labor stage 2, so we don't want tight pelvic floor. If the pelvic floor will be tight, so baby might stuck there, and it might give prolonged stage 2 labor because of the tightness into the pelvic floor. If the baby will stuck, might be doctor has to go for this kind of episiotomy and perineal tear. There might be female will go for perineal tear, or doctor might have to do episiotomy. They will open up they will cut incise the muscles. They will cut the muscles and the structure so the baby can come outside. So we really need a relaxed pelvic floor when we want to come outside, and we really need a strong pelvic floor whenever we want to hold. So if the female don't have a strong pelvic floor around the vagina, you can understand this, the vaginal tone and pelvic floor muscles, if they are not strong enough, so they will not have a grasping effect. They can't hold the penis. If they will not have this grasping effect of the penis, it is gonna give less proprioception to the brain. Brain will not get that the body is touching something. The touch effect will not be there. The grabbing effect will not be there. And if there will be no proprioception, brain will not get a signal. It can give female sexual dysfunctions, orgasmic dysfunctions, on low sexual desire, and some like kind of laxity, some kind of lax vagina, that kind of sensations inside into the female. So she might tell you also that laxity is there, vagina is too loose, because it is that why the vagina is loose, because of the loss of the tone of the vaginal muscles as well as the pelvic floor muscles, if that they are loose also. The door is weak. So it can affect female sexual functioning. Not only the female sexual functioning, if the pelvic floor muscles are loose into this central part, that is, vagina is a central canal. So through the center of gravity is going to pass. So gravity is always going to pull the organs downwards. And because of this downward pull, might be all the organs will start displacing from its position. They will start sagging downwards, and female can have another issue, which we are calling it as a pelvic organ prolapse. So we really need a very good and strong pelvic floor down there. And I'm not saying tight pelvic floor, I'm talking about strong pelvic floor, which has a good strength. Same way, when we are talking about, so pelvic organ prolapse can be there. Another thing is, if you talk about the rectum is the area where the stool is there, and anal canal is the area where the stool is going to pass. So we need a very good and strong muscles around that. So we have two muscles around the anal, that is external anal sphincter superficially, and internally we are having a puborectalis muscle, which is a part of levator ani. So we need a very strong levator ani, so the kinking and the angle can be maintained during the voiding and during the defecation, and we need a good external anal sphincters. So the compressive force should be maintained whenever we want to hold something. And same way, these muscles should know how to relax. So the coordination is also very, very important, when to contract and when to hold. So as per the need of the body, muscle should behave. So pelvic floor is also very, very important muscles. And just behind posterior to that, we have a coccyx. And we all understand that all these organs are lying inside the body into the pelvic bone. When we are talking that we are a pelvic rehab, we are a physiotherapist. So physiotherapy means treating muscles and the skeletal, both. So we are treating the bone, and we are also treating the muscles. So we should have a detailed understanding of the bone, what is the whole, what type of the bone is present in female and male, and what is anterior part we are calling. So we all know that anteriorly we have a pubic symphysis. All this both pelvic bones are coming and they are connecting into the central, and the central connected tissue is the pubic symphysis, and then again we have downwards to ischial tuberosity, our sits bone. So that is again a bony landmark. We know. Then we know the pubic rami, we know the inlet, we know the iliac crest, we know ASIS, PSIs. So we understood the pelvic bone, and at the back we have a sacrum. So one sacrum is attached with two ilium. So we have two sacroiliac joint posteriorly, right and left sacroiliac joint. So there are three connections into this bone. One is anterior, that's a pubic symphysis, and two are posterior, that are SI joint. And we know about the sacrum also. The sacrum is like a triangular bone which is having S1, 2, 3, and 4. So these are four reasons. At the very downward of the sacrum, we have a coccyx. So these are the posterior aspect of the bone. And we know the bony landmarks. You can palpate right now your pubic symphysis, you can palpate your pubic tubercle, you can palpate your ASIS, you can palpate your iliac crest, you can put your hand over the iliac crest, you can palpate ischial tuberosity, coccyx, and the sacrum, all the way S1, S2, S3, and S4. This palpation we already know. So we should have understanding of the bone and what is the biomechanics of this bone, how the biomechanics is going to change. I will keep letting you know when the things will come during the pregnancy and everything, and how the bone is under the effect of hormones. So I told you during puberty, when we have all these growth hormones are coming into picture, estrogen, progesterone, they are coming into picture. So the bone will start growing because internal reproductive organs will grow. So when they are growing, we need more space into the inlet and pelvic cavity. Bone has to expand. So this is what the widening of the bone, pelvic bone, starts during the during the puberty time period. That is because of the growth hormone, puberty hormones. So hormone is always gonna affect that some kind of kind of widening of the bone. Same way, this bone is gonna widen during the pregnancy when relaxing hormone will come, because baby required some space. Baby has to develop. Uterus needs space. The whole relaxing is gonna relax the bone, and that it's gonna relax the ligaments which is surrounding around this bone. So we have four ligaments also which is present. So they are four, like one is anterior pubic ligament. We have which is the central part, this red line is a pubic ligament, which is connecting both the bones together. Then we have one ilioinguinal ligament, which is coming from the right tubercle to the right ASIS, and left tubercle with the left ASIS. So we have this ilioinguinal ligament. So there are two ligaments which is present anteriorly, which is holding the bone. And we have two ligaments posteriorly. I'm going to say two. They are altogether two paired. So right and left. Okay. So we have two right and left SI joint. Posterior sacroiliac joint is also there between the sacrum and the ilium. Then we are having a sacrospinous ligament also between the spinous ischial spine process with the sacrum. So there are two paired sacrospinous ligament, right and left, two paired posterior SI joint, SI ligament, and two ilioinguinal ligament, and one pubic ligament. So they are the ligament of the bone, and this ligament has important role. What is the role of the ligament? They are maintaining what? Right tone into the ligaments and right consistency into the ligament. We don't want very loose ligament, and we don't want very tight ligament. So why we need this ligament around the bone? What do you think? Stability and maintaining the position. Okay. Like we don't want anterior tilt, we don't want posterior tilt, we don't want like a side asymmetry on the left and right side. So this kind of positioning, this kind of neutral position we require, and that positioning is because of the ligaments. So you know our pelvis is bit tilted anterior, not a very anterior, but it's like position like this. So if your ASI, your like PSIS is higher than your ASIS. So this is this neutral position is maintained by these ligament. Assume that female is having a tight ilioinguinal ligament, anterior ligament between the right tubercle and the right ASIS. If that ligament is tight, so what will happen? Anterior tilt or posterior tilt?
Anterior tilt.
Anterior tilt. So this is what is what is very, very common to see during the pregnancy. During pregnancy, there is a lot of load of the uterus is over this ligament, and this ligament is very tight. And because of that, most of the time, this whole pelvic bone is tilted forward. And if it is tilted forward, it is going to put strain on the posterior ligament, and it will create a kind of strain over as sacrospinous ligament. It will put strain over the posterior sacral ligament. That's why females, they have during the pregnancy, they have tightness into anterior side, anterior tilt, and that is going to cause the low doses over the posterior side, and the whole vertebra will be loaded anteriorly, and that will give pain over the SI joint, and it might do some kind of loosening effect over sacro, over the coccyx also. Females are more prone to develop coccydynia during pregnancy. So we now all understood the why, because of the tightness anteriorly is gonna put unnecessarily loosening and weakness, and the posterior part will be under the tension. So that can give the laxity effect to the female. So imbalance problem as well later on. So these ligaments are very, very, very important. We don't want any one ligament to tight. If one SI joint will be tight, SI joint ligament will tight, it is going to put strain on the other side of SI joint ligament. So same way, this is where if this pubic ligament is tight, more tight, so it will bring both pubic symphysis more closer to each other. So that is going to put strain over, kind of loading over the posterior side. So female will have a loose SI joint, or she will always keep having SI joint issues. So, or instability also female will develop. So definitely stability is the one thing, and maintaining the neutral positioning of the pubic bone is very, very important, which is done by the ligament. And there are, now you can assume that during C-section, when the babies, they are taking the baby outside, so there are chances to develop adhesion into the ilioinguinal ligament, anterior ligament. And that's why our female might have ilioinguinal ligaments. The female might have this kind of tension, cruciate pain around the pubic region in starting time period, and more straining over pubic. We have another round ligament is also coming into this region. So that ligament is coming. So we will understand that ligament also, but that anterior ligaments, that can be the round ligament, or that can be the ilioinguinal ligament, or it can be the pubic ligament. If they are tight because of the scarring, because of the adhesion, because of the inflammation of the C-section, so it can give issues to the female. And then we can understand, oh, why the female is having a tightness and pain around this region, and that how the referred pain will be at the back also. Okay, how it will create a weakness of the posterior ligaments, and it will create instability and imbalance to the female. Okay, so we will so ligaments are very, very important when we are talking about about this particular whole pelvic bone. And another thing is differentiation between the male and female bone. So this is also I covered into vulvovaginal health. So you guys are aware about that. And into vulvovaginal health, it is important to understand what lies into this region. What is mons pubis, what is labia majora, minora. We all have understanding. We should have understanding. And for that, this is what we covered in our vulvovaginal health. So, and then there was a female sexual organs, and vagina, G-spot, vaginal pH level, ecosystem, how to take care of the organs, what is the female sexual functioning. That is important when we are going to go towards the reproductive system. So this is what we already covered into the sexual health, vulvar health and sexual health. Now, as a physio, we know that we understood the pelvic bone, and that was given, that understanding was given in depth also during our curriculum time, during our when we were in college. So we know about the pelvic bone. And so what we don't know, what is there into the pelvic cavity. So let's understand first the organs, one after another. And let's understand their behavior, their functioning, and what can goes wrong, which can affect a female reproduction. Her reproduction might get affected. So what are those factors? Just starting. So I welcome you all in female reproductive health webinar by me. That was the first time I started in India in 2019. And now let's understand what is there. When we're talking about female reproductive health as a healthcare provider, we know that we are, as a physical therapist, want to help our female in this particular pelvic region. So we have a role, the physiotherapy has a role into all this reproductive system. But for understanding that, we should have a thorough understanding of uterus, cervix, fallopian tubes, ovary, their anatomy, physiology, function, dysfunction, and if there are some issues, how we can help, what are the management things already available, and how we can help as a physios. So for understanding this, let's just begin our topic, female reproductive health. So when we're talking about female reproductive health and female reproductive organs, so which are the organs which is present down there is two ovaries on the side. So we have two ovaries, and then we have this uterus. This is a fallopian tubes, which is a connection between the ovaries. So let me just create it for you. So our system is this. Two ovaries are present into the cavity. Then we have two fallopian tubes, which is connected with the uterus. Uterus is having, so these are the two fallopian tubes. They have a fimbrial-like structure, which is over the ovaries. So two fimbrias, two fallopian tubes, two ovaries, one uterus. Uterus is connected with the vagina, with the cervix, with the help of this cervix. So these are the organ which is present. So over here you can see ovary, two. This is attached with the uterus with the ovarian ligament. This is ovarian ligament. Then we have two connections here, fallopian tubes. These fallopian tubes are the connection between the ovary and the uterus. So there are two fallopian tubes. Then we have this uterus. And uterus is again connected with the vagina by the cervix. Okay. And outside into the female vulva, we can see female vestibule. We can see what? External vaginal orifice. So now all together, vagina, cervix, uterus, fallopian tubes, and ovaries. They are the part of reproductive system. So vagina is a part of both sexual as well as reproduction. And our primary sexual organ is clitoris, but vagina also has a role during the sexual functioning when the penis will go inside vagina, because the anterior wall of the vagina is gonna be responsible for this kind of proprioception. Okay, you understood that also in sexual health. So this is our organ, and this organ is lying in a pelvic cavity. How? What is the positioning of this organ? So let's understand that also. Now, this particular reproductive organs are they were not developed before the puberty. In a girl around 7 years, 8 years, they are very small girls. Their reproductive system is not active. They are not having the periods. Okay, period doesn't start during this particular time. Period is a sign of reproduction, that she's ready for the reproduction. She can get pregnant now. So before that, the body goes with the puberty time period. In this puberty time period, female is going to have all the development of internal organ. So which is the more important internal organ? That is the ovary. So ovary size was less than 1 centimeter cube before this puberty. But during the puberty itself, within these 2 years, the ovaries are going to develop because of this growth hormone body is going to secrete. And because that is going to come from the hypothalamus. So hypothalamus will send all this hormones secretion in the body, and body internal ovaries will start getting bigger into size. Not only the ovaries are developing in bigger, even the uterus, even attached structures like fallopian tubes, cervix, vagina, everything is going to expand and develop into the size. Their layers, their mucosas, their what we are saying is smooth muscles, they all, the mucosal layer, they all are their cells, they all are going to develop, they all starting developing during the puberty time period. So after this puberty, when the organs will be developed completely, another thing is ovary. Where ovary is a organ which has the function of producing not only the developing not only the eggs, they have a function because that's a gland actually. So this gland is going to produce some hormones. So once the ovary will start getting bigger into size, that is going to start development, that is going to release some hormones into the body. So ovary is responsible for release of the hormones. So androgen hormone is the first hormone which is going to come from the ovary, and this androgen is going to be responsible for the hair development, because hair is a protective sheath of our body, and they have a special nerve cells which is attached with the hair. So that is very, very sensual to touch also. And they are the site of perspiration. So we have these small glands present beneath the hair. So through these glands, all the liquid which will come around the axilla, around the pubic region, because we don't want dryness around this area. We need lubrication around this area. So the glands will get active, and those glands is going to secrete the liquid, and that liquid will come outside. And so that is through these pores, hair pores, which is present. And each hair follicle is attached with the nerve ending. So that nerve ending is also going to send a signal to the brain. When you touch your axillary hair, you touch your pubic hair, the sensation will be different. More sensation will be there. So the vulvar area will get sensational. Sensual actually. So because this is a part of secondary sexual organ, vulva is a secondary sexual organ. So this activation and development is going on because of the hair. And here, why hair is coming? That is coming because of the androgen. And from where the androgen is coming? Androgen is coming from the developed ovary. More developed ovary will be there, more androgen secretion will be there, and more good hair quality, hair growth will be there around this region. And not only the hair androgen is responsible for, that is responsible for the another cushions of our body. What is other cushion? Other cushion is a fat. We need a fat layer because we want our organs to be secured in a right. We don't want unnecessarily something can come and damage the structures, and sudden thirst can come and put a strain over the pelvic region. So we need some kind of fatty layer developed in our body. So the fat cells is required, very, very important, into the mammary gland, around the breast cells. So all this fat is going to develop this because of the androgen, and that is going to give a different shape to the female also. So female can start acquiring fat around the hip region, around the glutes, around the thighs, around the breast. So this is why during the puberty, fat development is also another one sign and symptoms which we can observe in our this young girl, that she's developing now. Her body is changing into the shape and size. And so ovary is very, very important. Once the ovary will, why the body was not showing those kind of shape before puberty? Because before there was no fat cells, was not that much. Okay, mammary glands was not developing. So we need that fat accumulation around the mammary gland. We also need this fat accumulation around the pubic region, around this mons pubis. So mons pubis also we have the fatty layers, which is going to give a protection to the pubic symphysis, our pubic bone, our connective tissue. So that need to be preserved. So nothing direct thrust can hit the bone and create a damage and any kind of fractures and tearing. We don't want that. So tissues are more safe because of the fat which is present on the beneath the pubic mons pubis. So fat layers are protective layers of our body, which is going to come from the androgen. So that is, once the ovary will develop, that is going to give those kind of protective layers to us. Same way, when ovaries are developing, one day ovary will be completely developed, that will acquire a shape and size, and now the hormones will also come at that time. One day ovulation, body will release the egg, and after releasing the egg, ovulation will happen. Now body will have an egg. Now uterus has to be ready, where that fertilization can happen, because ovary will be ready, even the vagina will be also ready by expanding. So the size of the vagina will be there, mucosa of the vagina will be developed after the puberty time period. The lengthening of the vagina will also be there. Hymen tissue which was present, the protective covering, that will also start getting some kind of proliferation. So body is gonna like prepare itself so the sperm can come inside. And inside the body through the vagina. So once the sperm will come and sperm will meet with the egg, so we need, after the fertilization, uterus should be ready for the implantation. So the placental development should be starting from the uterus. So we need a good size of the uterus where the reproduction can occur. So this is what his body is preparing during this particular 6 to 8 years of time. So between it start at age of 8, and the whole body will be completely ready by the age of 16. The development of internal organ, external organs, sexual hormones, everything will be functional, and body is ready for the pregnancy. So ovaries are ready, uterus are ready, fallopian tubes are ready, vagina is ready, vulva is ready, everything is ready. That is the responsibility of the puberty time period and adolescent time period. So, and even the opening, around the opening, we were having a hymen. So hymen will also start showing you some kind of proliferation, some kind of openings down there. So hymen is, the hymen tissue is also stretched out. So there is a room for the penetration. So that is also developed by the body hormones. Estrogen hormones is responsible for that. So we understood that, we already understood that in puberty session. So let's go one by other. Okay, so far what we cover in vulvovaginal health was a vagina. So any question about vagina? You understood vagina, the development of the vagina?
Yes, ma'am.
Okay. So after vagina, the next organ which is present, so let's understand vagina again. That was a vagina. It was having an external opening and internal opening. Internal opening of the vagina is going to come in correlation with the what? Uterus, isn't it? Uterus is attached with the vagina. So let's understand this. What is the more internal structure? So next is the cervix. So you understood the vagina already. This was a vagina. And then we are going into the cervix. Before going further, I want to show you something. Okay. Yeah, this picture is very, very important to understand. Our uterus and our vagina is present into the pelvic region in a specific axis, specific position. So like this is a uterus, this is cervix, and this is vagina. So there are two angles they are creating with each other, and there is another third axis is also there. Three axes are present. So in USG reports, whenever our patient will come to us, doesn't matter, might be the patient is coming to you just a simple during the pregnancy, patient is coming to you in postnatal time period, or is coming for the pelvic rehab problems, or whenever the patient is coming to you, please ask your patient about USG reports and check into the USG reports what is the positioning of the uterus, because uterus position is going to give us a lot of idea what is going on into the pelvic region. Okay, so the right position and right axis of the uterus is this one. Uterus is antiverted and anti-flexion into the position. Antiversion and anti-flexion. So another thing which we have to look into so there should not be written retroversion. or extension. Okay, so it should be anteversion and anteflexion. And the second thing which we will look is the axis. So when we are talking about the anteversion, so there's a long axis of the vagina with the cervix. So this is the cervix, this is the cervix, and this is the vagina. So cervix, let me take another color of pen. Cervix and vagina. So this axis should be 90 degree. Okay. Not this one. This one. This. Yeah. This one actually. Cervix and the vagina. So this angle should be 90 degree. So this is the cervix. This and this. 90 degree axis it should be. Okay. Second is the axis between uterus and the cervix. Uterus and cervix. So that axis will become 120 to 170. And the second axis is between that. So this, let me make you clear again. Again, okay, girls, let me show you. The first, there are three axes. I'm using purple color pen. So first axis is between the cervix and the vagina. So this is the axis of vagina. You do a straight line, the dark blue color of line, this one. And then we have so this one, okay. Then you create a line between the cervix. So this is a straight line of the cervix. This and this. This is one axis. So cervix and vagina. Then we have axis between the uterus and the cervix. Okay. This one. So they both will be 120 degree, 120 to 170 degree. And then we have a long axis of vagina and the cervix. This one, upper part. This will become 90 degree. Okay, so this is the two axes which we have to always see into the sonography reports. One is between this and this, 90 degree. One is between uterus and the cervix. This will become 120 degree. One will become cervix and the vagina. So it will also become 120 to 170 degree. These are two angles. 120. This is 1 and 2. 120 to 170 degree. And third is this one. Between the cervix and the vagina, it will be the 90 degree. So these three angles, we have to look into the sonography reports. If the angle is changing, so assume so what is the uterus position in correlation with the vagina? Like this. Look, it is creating kind of 7. It's like 90 degree actually, like that. Like this, 90 degree axis is there. So this is a right position. And in this position, beneath the uterus here which organ is present? Bladder is present.
Bladder.
Yeah, bladder is present. Bladder is lying here. So in this image, you can see bladder is there. And bladder is having a canal, this urethral canal, which is also attached with that. This is a urethral canal. And on the top of, so where uterus is present? Behind the bladder or on the top of the bladder?
On top of the bladder.
So what is the positioning of the bladder? Bladder is uterus is present on the top of the bladder. And which lies behind the bladder?
So cervix and vagina.
Yes, cervix and vagina. So behind the bladder, upper part of the cervix and upper part of the vagina is lying. So let me again show you. So this is the behind part. So this is a posterior area of the bladder, posterior part. And posterior part, what is lying? Lower part of the cervix and upper part of the vagina. So this is the upper part of the vagina. And what is the lower part of the vagina is present behind the urethra. Clear, everyone?
No, China.
Clear?
Yes, ma'am. Yes, ma'am.
Okay. So this is the position. So now what is the responsible factor? Who is maintaining the position of this uterus? How the position is maintained? Who is responsible for that?
Pelvic floor muscles.
Okay, so they are present at the back. In this image, you can see this is the pelvic floor muscle, this sheath which is going on. So this is a pelvic floor muscle. Okay, what else?
Ligaments.
Ligaments. Yes, which ligaments? Ligament of organs or of pelvic bone?
Pelvic bone.
Organs.
Organs. Or every organ has their own individual ligament. Our pelvic bone has its ligament, which is maintaining its position, its stability. Same way, organ is also having its own ligament. So there are three things which is responsible for this positioning. One is that tone of the vagina. The more strong, good tone of the vagina will be there, vagina will not sag downward. Okay, because vagina is healthy vagina. The tone is there, wall of the vagina is healthy. So they will not pull the uterus downward. So tone of the vagina is very, very important, which is responsible for this position. Second, tone of the pelvic floor muscle. Pelvic floor will, if they are healthy, they will not let the organ come downwards. So pelvic floor. And very important is organ itself. It has its own ligaments. So there are four ligaments, not four ligaments, three ligaments. Around the uterus, there are ligaments around the cervix, and there is ligament around the vagina. So these ligaments are coming from the bones. So we have pubic symphysis anteriorly, and we have sacrum at the back. So anterior portion, we have a sidewise ilium also. So the ligaments are coming from all the sides of this pelvic bone, and which is gonna come, one part of the this ligament is gonna join with the organ, like a part will join with the uterus, other part will insert into the bone. So one part will come from the uterus, other will go onto the side of the pelvic bone, ilium. One will attach at the posterior side, this ligament, and that other part will attach with the either the sacrum or the other structures. So we have three things which is maintaining the positioning of this, and the fourth important thing which is responsible is the organs, supported neighbor or organ. So what is the neighbor organ? Bladder. So bladder is also providing a support to the uterus. If the bladder is not in a right position, for example, bladder will start falling downward, cystocele is going on. If this bladder will start it will start falling like this, it will fall back. So this support of the uterus will be loose. Might be uterus will also start falling backward with this. So organs are also supporting each other. Like if me and with me, I'm a central part, and there's something ahead me and something is behind me. So these two things are also responsible for a good support. So good tone into the muscles of the bladder. So when the bladder is healthy bladder, strong bladder, the muscles has a good tone also. So that will also provide a good support to me. And same way, the rectum posteriorly. When the rectum has a good tone, so that is going to support the posterior wall of the vagina and the posterior part of the cervix by the strong, good toned rectum. Okay, so we need a good tone into the organs, supported organs. So bladder and the rectum, they are the supportive system for the internal reproductive area. Clear about this? There are four things which is maintaining the position. Out of this four thing, very, very important is its own ligaments, uterus own ligament. Second, organs which is nearby, bladder or the rectum, and tone of the organs, vagina which is attached directly with the cervix, how strong, high good tone is there into the vaginal tissue. Third is fourth is the pelvic floor, and fifth is activity. If the female is involved in those kind of activity, like if she has lot of breath hold, she's keep having COPD conditions. So intra-abdominal pressure is always increased. So that can always put downward pressure. So we don't want high intra-abdominal pressure increased into the abdomen. So that pressures will always fall over the organ. They might be they might responsible for the changing into the position and the axis. They will put loading over the organs. Another is any activity which we are doing against the gravity. So if we are doing lot of weightlifting, we are doing a lot of squats, lot of lunges by increasing intra-abdominal pressure. So that might always weaken our that always affect the gravity, how the gravity is falling downwards, and gravity can always pull the things downwards. So we can understand that our physical activity, where the gravity is also playing a role and intra-abdominal pressure is also playing a role, they can also create, they are also responsible for the shifting of the position of our uterus. Clear, everyone? There are 4 supportive structures and activities are also responsible. Yep.
I have a question.
Sorry, yeah, ask. Clear?
Is this squat and lunge is bad for pelvic floor?
What?
Is the squat and lunge bad for pelvic floor muscles?
Depending upon what type of pelvic floor muscles are there. If the pelvic floor muscles are active pelvic floor, strong pelvic floor, good pelvic floor, so you can go with those activities, but those should not be the vigorous activity. Okay, so whenever we are doing squatting and whenever we are doing lunges, we should always squeeze the pelvic floor first and then do the activity. It should not be the relaxing of the pelvic floor and then doing the squats. It will create more weakness into the pelvic floor. So right breathing pattern is very important, and right contraction of the pelvic floor before starting other activity is very important. So depending upon how strong is the pelvic floor, according to that, we should plan the activity squats and lunges. They are not always bad, because there might be some condition where the pelvic floor muscles are tight and over spasmodic, over shortening of the muscles are there. So we might have to go for those kind of activities, depending upon what is the right status, right now, the status of the patient. What is the status of the pelvic floor right now? And according to that, we can advise our patients that squatting is good or it's not good. There are 2 types of pelvic floor dysfunction: hypotonous pelvic floor and hypertonous pelvic floor. Hypo means when the pelvic floor muscle tone is weak. And if the pelvic floor muscle tone is weak, organs are sagging downwards. So of course, squatting is bad. We should not give squatting to the patient. Lunges are bad because it is weak pelvic floor, weak structures. So organs are going to pull more downward because of the gravity. So we have to avoid squats and lunges. There can be a second scenario where our muscles are over tight. When the muscles are over tight and the ligaments are over tight, the ligaments which supports the organs, they are over tight. For those conditions, we might have to give them more activities which increase intra-abdominal pressure, or which helps to relax the pelvic floor, or activity or positions which has a role of the gravity. So gravity can help in relaxation of the pelvic floor muscles. So the answer is complicated. That answer is according to the condition of the patient. So for that, you please try to watch the video onto the YouTube so you can understand the basics of pelvic floor. Okay, dear? Clear?
Okay, thank you.
All right. So this is the important axis which we have to always look into the USG reports. And now, this is a beautiful organ, uterus. We'll talk about uterus, but let's talk about the cervix first. Another thing I wanted to show you here is this, another picture. Yeah, this one. This picture. Okay. Now, in this image, we know this is a pubic symphysis anteriorly. We have this pubic rami, this is pubic tubercle, and it's going on iliac crust will be there. And then at the back, we have a coccyx. This is a coccyx. Okay, this is the coccyx. So this is all bone on the sides. Now on the side, now anteriorly behind the pubic symphysis, our first organ is lying. This part is the bladder. And behind this bladder, we have this vagina and the cervix. Then we have this vaginal canal is there. Then we have at the posterior rectum. And then we have all these downward is the pelvic floor muscles. You can see over pubovagiнаlis muscle, puborectalis muscle. There anococcygeal, this external anal sphincter muscles are also there posteriorly. So these are the pelvic floor muscles back. Iliococcygeal muscle, okay, coccygeal muscle, they all are present here. So these are the pelvic floor muscle downward, these ones. And these are the canal. These are the organ, bladder, vaginal canal, and this is the rectum at the back. On the top of the bladder, we have this uterus. Okay, and uterus and vagina, 90-degree angle. Okay. Clear about this image?
Yes, ma'am.
On the top of this uterus, we have all these small intestines present. So the girls or the women who remove the uterus, they remove the hysterectomy is done. So they remove the uterus, so this part will be empty, and that particular part will assume that there is no uterus now. They have removed it. So over this part, what will come? Who's going to take care of this part, this space?
The small
intestines. So small intestine will come in direct connection with the cervix or the upper part of the vagina. So over top of the vagina, automatically the small intestine will fall. So on the top of the bladder, on the top of the this vaginal upper part or the rectum, all the small intestines are gonna take care of the space. Clear? Another thing I want to show you here is, let me first erase spaces between these two organs. So now we have anterior organ, bladder, and posterior organ is a rectum. So vaginal peritoneal cavity. So this is the external layer of the internal organs, peritoneal layer. So you can see in this image, bladder it has its own sheath, the skin. And same way, vagina also has its own skin. And at the back, vaginal posterior wall and the rectum, they have their own sheath. So you can see that there is a space placed between two organs. The space is there between the bladder and the vagina, bladder and the uterus. There are two spaces. I want you to focus here. Bladder and uterus. Then we have a space posterior between uterus and rectum. Clear? There are two spaces are there. The anterior space, we call it as a utrovesical pouch. Utero means uterus, vesicle means bladder. So this pouch, anterior pouch, we are calling it as a utrovesical pouch. Look, vesicouterine pouch. It is written here. This is, I'm sorry, the image is already here. So vesicouterine pouch or utrovesical pouch, it's okay. It's the same name. So space between the uterus and the bladder, vesicouterine pouch. Same way, posterior space between the uterus and the rectum is the rectouterine pouch. Recto and uterine, rectouterine. Vesico and uterine, vesicouterine pouch. In some books, it might be written utrovesicular pouch or might be written pouch of Douglas. This one, rectouterine pouch means pouch of Douglas. Just give me 1 minute, girls. You can just take care of this. Just I'm sorry, girls. So I hope that you understood there are two pouches, vesicouterine pouch and rectouterine pouch. Rectouterine pouch, some books will tell you pouch of Douglas. Okay, it is the same, other name of that, pouch of Douglas. So why these two spaces are important to understand, you will get this in upcoming slides. You will get the clarity why this space is important. Okay, sometimes into this space, fallopian, like this space is important for the mobility. Whenever we want expansion of the vagina, for example, female is ready for, she's aroused, she want to have a sexual intercourse. So whenever body is ready for the intercourse, vagina is going to go for lengthening, and uterus is, it is going to put pressure because vagina need more lengthened, more space. So what vagina will do, it will put a pressure over the cervix, and cervix will move upwards. When the cervix will move upward, uterus will also start moving upward into the abdominal cavity. This is already we understood into the sexual stages, that how the uterus is gonna move upwards. So once the uterus will move upward, so this particular part, this layer is, this pouch is gonna move upward. So this is the area where that this particular site, we are calling it as, inside the vagina, we are calling it as the posterior fornix of the vagina. You understood the fornix? Did I explain to you what is the fornix? Anterior, posterior, lateral fornix, or no?
No, ma'am.
No,
No,
okay.
no.
Yeah, so we
No,
haven't had this understanding that what is this fornix. Let me explain you. Yeah, so this is one image. Okay, let me show you another image where we have a more clear picture. Yep, this is a good picture actually. So vaginal tissue, vaginal line or part, vaginal internal part. Okay. I told you that vagina is having two opening, external and internal opening. Second, it has three layers: peritoneal, mucosal, smooth muscle, and the mucosal layer. There are three layers of that. And it has four walls: anterior wall towards the pubic symphysis, posterior wall towards the rectum, and two lateral walls towards the pelvic floor. So four walls are there. Same way, vagina is also having four fornix. What is the fornix? Fornix means connection. Once the vaginal upper part is going to come in a connection with the cervix. So this upper part is going to create some fold. Anterior wall of the vagina will start having a connection with the anterior wall of the cervix. So it will create this kind of one corner anteriorly, and we will call it as the anterior fornix. Same way, vaginal posterior wall is going to have a connection with the posterior surface of the cervix. This one. And this posterior cervix with the posterior vaginal wall, they will create a posterior fornix. Okay. And now, same way, we have two lateral side of the cervix. Assume that this is the cervix, which is coming from the uterus, and this is a vagina, which I'm attaching it. So once I'm attaching the vagina, so that attachment is from all the sides, anterior, posterior, and two lateral. So there are four fornix: anterior fornix, posterior fornix, and two lateral fornix. So now during the pregnancy, when the uterus is going to expand, so what will happen? Anterior fornix will be lengthened. There will be no anterior fornix actually. The straight vagina and the cervix will be there straight. So there's going to create this going to diminish the fornix, anterior fornix. So no anterior fornix will be there during the pregnancy because of the stretching of the uterus. So this corner, this kind of skin is kind of is folding like this. So this is going to create a stretching, whole stretching of the uterus is going to create the stretching of the fornix. So the anterior fornix is going to diminish during the pregnancy. There's going to lengthen up and stretch out the anterior wall of the vagina also. Same way, whenever female is aroused and she's into the third stage, when penetration is going on, the penis is entering inside the vagina. So during this particular time period, what we need, where the penis, if there's a long size of the penis, for example, penis is around 8 centimeter long or 9 centimeter long, lengthy penis is there, but vagina size is around 6 centimeter or 7 centimeter. The long size of the penis, where the penis will go, you know where the penis is going during the
Posterior
session?
fornix.
Posterior fornix. So that will go behind the cervix, posteriorly, that particular space. That's going to create a stretching of the posterior part of the vagina, this fornix. That will strengthen, stretch out the tissue posteriorly. And the penis will go here in this fornix. So this, assume that this is the penis. It will go here. So more expansion of the posterior fornix is going to happen during that. And doctors are gonna, you might have seen this IVF. During IVF, when doctors are taking the, like they're preparing a female for the ovulation, they might take, or when the fallopian tubes are blocked, they might take some eggs for fertilization, isn't it? They are preparing the eggs, and then after the preparation, they will take the eggs. So through this lateral fornix, this the needles will enter and they will go towards the what we are saying is the ovaries. So from both lateral sides, we can touch the ovaries. So assume that this is a female and this is the ovary of the female. So lateral side of this fornix, that needle will come and pierce the this one, ovaries. So whenever we are doing palpation of the ovaries, the doctors are doing palpation of the ovaries through the vagina, they are going into the lateral fornix, more upward, right and left. Clear, everyone?
Yes, ma'am.
Okay.
Yes.
Okay. So there are 4 phonics. They are the connection of this vagina. Okay. Now let's go back. Now let's start our topic of the of today, cervix, our first organ to understand. Now, when we are talking about the cervix, again, cervix is a part of genital tract located between uterus and vagina. We know that that's a part between the uterus and the vagina, more central part. Some books will tell you that neck of the uterus. It's like a neck, like we have this neck, our neck, which is the space between the head and the thorax. So same way, the neck of the uterus or the cervix is a part, is a connection of the uterus and the vagina. This is a tunnel, kind of tunnel. And this particular organ, small organ, is having its 3 walls. All the organs having its 3 walls. So you can see one is the outer skin layer, that's a peritoneal cavity. Another is a middle layer, which is made up with the muscles, smooth muscles. And more internal is the mucosal layer. Every organ is having the same layers. Okay. So outer is a peritoneal, middle is the smooth muscle, and inner is the this mucosal layer. Mucosal layer means mucosal sheath is present. Some cells are present. Some skin is present into those layers. Okay, and they have their some secretion kind of behavior. Something is going to secrete through the mucosa. They're going to secrete something. Like vaginal mucosa was secreting some perspiration. Same way, this is going to be responsible for the secretion. And now the second middle one, this is like, you know, the more stronger layer is present around the cervix. That you can compare as a like a myometrium. Uterus is having a myometrium, which is the smooth muscle. Same way, we have a smooth muscle layer present here. And this smooth muscle layer is a very, very strong smooth muscle layer. So this, it's like, it has a kind of contraction and opening, relaxation ability. So it goes for contraction and it sometimes open up also. So that's the functioning of the cervix. This central part, this middle layer, smooth muscle. So that is that open up, but this particular cervix, the central part of this part of the cervix is under the effect of hormones. So this cervix is not always open. It is like a lock. It's like a door, and this door is always closed. Mostly it is closed. We don't want that anything which is coming inside the vagina, any bacteria, any virus, that bacteria, virus, any pathogen, any air, we don't want that thing to go into the uterus. Okay, we want uterus, if anything will go into the uterus, from the uterus, that particular pathogen and external substance can enter into the fallopian tube. And from the fallopian tube, that substance can enter into the abdominal cavity, because fallopian tubes are open into the abdominal cavity. They are not connected with something. So any bacteria and infection can directly go to the abdominal cavity. We don't want that. So that's why the body has its strong system, the door present here around the lower part of the uterus. And this strong door, we are calling it as a cervix. And into this strong door, we have a strong muscles present. The layer of the muscle is present, smooth muscle. And that has a special effect whenever body is secreting some special hormone. So when estrogen level will be high during ovulation, then only the muscle is going to act. So that is going to create some kind of opening of this area. Whenever we have some hormones like the ejaculation is going on inside the vagina, so the semen will be there. So semen has those hormones, those chemicals, which will create a softening of these tissues, mucosal tissues here. That will also create a opening effect into the cervix. So there are some chemicals, some phases in our life which can open up the door. Otherwise, the door will be always closed. Now, what are those phases? The phase, ovulatory phase, when the ovulation is there, egg is released. So when egg is released, body wants to get fertilized. So it is body, its own mechanism, it will open up the door. So door will be open on that particular 1 or 2 days till the time egg is present. The door will be soft and open, and this is going to create the laxity or kind of opening effect into this smooth muscle around the cervix. And this third is during now once the progesterone effect will be high, like this is the estrogen effect, estrogen will do opening, but once the progesterone will be there in a body, high progesterone, like after the placenta is the organ which is going to supply the progesterone in a female body. So during that particular phase, when high level of progesterone is there in a female body, that is going to create a closing of the cervix. Now estrogen will open up and the progesterone will close it. Now during that labor time period, when the relaxing hormone effect will be there, now after this, when the baby is completely developed, uterus is pulling the baby downwards, myometrium is contracting, we need the door should be open. At that time, relaxing hormone will come and relax the cervix. It will create a opening of that. So this cervix is always under the effect of these hormones, estrogen, progesterone, relaxing, and some sexual hormones, testosterone. That is also going to create a relaxation. And the hormones, the chemicals which is present into the semen. So whenever the man is ejaculating inside the vagina, that semen, that liquid is going to softener, create a room, it's going to create an opening of that. So it means opening and closing is what is going on into the cervical structure, and that opening and closing is under the effect of the hormones and the chemical released by the semen. So whenever you are you are having a like intercourse, whenever you are having intercourse without condom and ejaculation is there, that is creating the thinning of the opening of the cervix, thinning of the cervix. Okay. So cervix is under the effect of the hormones. And once these hormones are not there, our cervix is like a door, completely closed door. We don't want anything to go inside the vagina. Cervix is a part between the uterus and the vagina, and it is the narrow end of uterus which protrude into the vagina and provides a passage for sperm to enter. And this is a passage actually. Through this passage, sperm can go inside. And what else can and what can come outside? Periods. Every month periods are coming outside. We don't want completely closed door. Whenever the estrogen progesterone will go out, the fall of the estrogen progesterone during the periods, the blood is there, the blood is going to leave through the door. So that time also during menstruation, our cervix is open cervix, and through this open cervix, the blood will keep going outside. Okay. And same way, same thing happened after the labor. When the baby came outside after crossing the cervix, it will come. The baby will come towards the vagina. After that, baby will come. After crossing that, the pelvic floor, it will come into the outer world, and the placenta will come, and the bleeding will be continue. So that's how this cervix is open up to 14 to 21 days during the postnatal time period. More opening is going on. More dilation of the cervix is going on. More still dilated cervix will be there for 21 days in a female after vaginal delivery. So cervix is a passage, and cervix is made up of fibromuscular tissue with the lining of a cervical mucosa. Cervical mucosa is a mucosal sheath which is present into the central part here. Okay, it is a fibromuscular. When we are saying is a fibromuscular, same tissue is present around the uterus. Fibrous arrangement is there, muscular arrangement is there. So those fibrous arrangement is like in all the directions, like a spiral kind of longitudinal, round, ring-like structures, more lengthening, widening, ring-like structures. So more widening can also happen. So it's like a rubber band. You can stretch out the rubber band, and like a ring, you can stretch it out. And as a whole round, the organ will be out, open up. And whatever is inside the uterus can come outside during the labor time period. Okay. So it's a fibromuscular tissue. And into this tissue, you understood how the property of this muscular layer, but the mucosal layer, which is present inside, into this mucosal layer, we have a thick mucus layer present. So this mucus layer, which I'm saying, mucus plug, it's like a mucus plug. And this mucus plug is under the effect of hormones. The mucus plug is like a wax. It's like a strong glue. And this strong glue, when the glue is strong, nothing can go inside. But whenever hormones are there, the hormones will create a thinning of the glue, and then they will have a space. Then something can go inside the uterus or something can come outside. So this glue-like structure is creating the consistency, and this glue will be very thick glue during the pregnancy, because when the baby is developing inside the uterus, we don't want the baby to fall outside, because from the downward, gravity will keep putting pressure over the vagina, that will pull the vagina downwards. And once the vagina will be downward, it will pull the cervix downward. There might be some extra kind of loading going on over the cervix, and might be cervix open up. If the cervix will open up, the baby will fall out as per the gravity. So we don't want that. So that's how the plug is very, very strong plug during the pregnancy because of the progesterone hormone. Too much of progesterone is there. So too much of strong mucus will be there into this area. So mucus plug will be very, very strong mucus plug. And now this mucus plug will thin out during the labor time because of the relaxing hormone. And in this, beneath this mucosal sheath or this mucosal layer, the central layer, like this one, the central inner layer, beneath this, we have a glands, like many glands are present, small glands are present. And these glands are responsible for secretion of this mucus. Now, from where this mucus is coming? The mucus is coming from the glands which present beneath the mucosal layer. Okay. That's how you might have already always noticed. So in your panty area also, the middle of your panty, there is some kind of secretion and some kind of liquid is always there. So what is this secretion? Secretion is coming from the vagina, vaginal sheath. That secretion is also coming from the cervix. Cervical mucus is the secretion liquid is also coming from the gland which is present into the cervix of this area. Okay. So now how many parts of this cervix? So this is the cervix. This particular area is the cervix. Now how many parts? There are two parts. One is the part which is inside of this whole tunnel, whole canal. So small canal is present. The length of the small canal is around 4 centimeters. So what the right size of the cervix is 4 centimeters, 3.5 to 4 centimeters. If you saw, so this is the size of the cervix. So we have a healthy cervix, good length of the cervix. But if the size of the cervix is less than 3.5, it is 2 centimeters long, 2.5 centimeters long. So that is a shorter cervix, short cervix present in a female body, and short cervix is present. So you can understand short cervix means short endo cervical area. So this particular whole length, we are calling it as a endo cervix, endo, internal part of the tunnel. And outside part, the part which you can feel into the vagina. Right now, if you are, all of we as a girl, if we insert our finger inside the vagina, we will see that something is falling into the vagina from the top. And this particular structure which we can feel with our finger, this is the ectocervix part. The doctors, the nurse, that healthcare providers, that keep checking during the pregnancy, late stage of the pregnancy, third stage, that during the labor time period, they check the how much dilation is going on. They check the ectocervix part. They can look at the ectocervix. Okay, so it is something like you can see my hand outside. So this part is the ectocervix. This outer part is the ectocervix, and the tunnel, this tunnel, inner part of this tunnel is the endocervical part. Ecto is outside. So if this is a glass, this part which we can palpate with our finger into the vagina, it is the ectocervix. Into the ectocervical part, the central part, we have a external os is present into the center. Okay, so this is the ectocervix and external os. And inside of this glass, this particular thing is the endocervical part. So endo and ecto. And in ecto, we have an external os, and ectocervical part is the palpable part. And the skin of endo and ecto is different. There is more soft tissues are present here. The consistency of, like, acidic nature of the cervix. So inside this particular part is more acidic into nature. So they will not let anything to go and cross the part. Any bacteria, the acidic nature is going to die the bacteria. They will die up. That much of high, this like 2 is the pH level of the cervix is 2, around 2.5 and 2. Very, very high acidic into nature. They will kill everything. But external part is gonna come in connection with the vagina, because vagina is also starting on the, like, by creating the fornix on the sides, like lateral fornix, anterior fornix, posterior fornix. So this particular endocervix part is gonna come in connection with the vagina. So this site is more prone to, so this is a merging site. Actually, merging cells are present. Two type of cells are present: epithelial cells of the vagina also, and some cells of the cervix also. They will merge with each other. And into the upper part of the vagina, we have a bacteria line. Lactobacilli bacteria is also living into this region. And the pH level of the vagina is around 3.5 and 4.8, where some bacteria can develop. Okay, but pH level of cervix is very, very acidic. And but this particular part is a kind of it's a transitional phase between transitional site. Some part will come in contact with vagina, and some part is going to come in contact with the cervix. So this site is kind of more prone to get infections, this part of the cervix. And this is where the cervical cancers begins, in external part. So if any virus which can come, and it can start affecting first the external part, this part, and this is what the beginning of cervical stage 1, cervical cancer stage 1, external part damage. Once the cervical cancer is going to damage, after damaging this one, it start damaging the internal part, ectocervical. This is what we are calling it as a cervical cancer stage 2, when it starts damaging the internal part also. So external part is more fragile part. Actually, you can say that whenever childbirth is going on, so this part is gonna come more downwards, because babies go more open. It will do more opening of this is gonna happen. All this central external os, it will open up like this. So central os is like this, kind of closed, and it will open like that. Okay, the baby will come out. So this tissue of the cervix is gonna come more closer with the vaginal tissue. that area, this tissue is gonna come in contact with the vaginal environment. Not only the vaginal environment, even external environment also sometimes. External environment also, because of the more downward displacement during the pregnancy, during the labor time period. Because uterus is getting a contractions, and because of the contraction, the cervix will pull downwards. It will come downwards. So this structure is gonna come more into the vagina at that time. So depending upon how many times female has gone through the pregnancy, how many times the same issue happened with the cervix. So more prone to get damage to those external tissues of the cervix because of this delivery process. So 1 time, 2 time, 3 time, 4 time pregnancy, 5 time pregnancy. So more damage, this ectocervical part will be there. And that tissue is more prone to get even infection because the pH level is somewhere not very strong as the internal part of the cervix. Okay, so that's how female can have a cervical inflammation, cervical infections into this part, or cervical cancers also. So you can see this is ectocervical part, which is more prone to get infections, and into ectocervical part is a part which you can palpate, you can touch through your vagina by your finger. Right now also you insert your finger, you will feel that ectocervical part. Into ectocervical part, into the center, we are having an external os. External os is something, that kind of feeling that when you are touching your umbilicus. So right now you touch your tummy, and into your tummy you have your umbilical area. So the same feeling you are going to feel inside your vagina when you touch your external os. So as this is written into this image, look, this is a transformation zone. So two things are going to come into connection: vaginal surface area as well as the cervical surface area. They both are merging with each other, and that is making this particular area more prone to get, more sensitive, more prone to get infections, early infections, this transitional zone. In this image, you can appreciate this kind of light gray color area. Okay, ectocervical part. So there are two parts. One is the more inside, more secure, more acidic into nature, and that is the endocervical part. Into this endocervical part, more mucosal layer is present, and this mucosal layer is gonna, and many glands are present. So more secretion of the gland, more thick mucosal gland, more thick plug, more closer the door is, and nothing can go inside the vagina. Okay, but yes, that endocervical part can always, hormones and chemicals can always influence that. Chemicals means that body, its own chemicals, like, you know, semen is there, some any fluid, with the body fluid, they can always affect. Okay, and this is the ectocervical part, which is the external part, which is protruded inside the vagina, which can be we can feel it, we can palpate it. All right. So the ectocervix is the part of the cervix that can be seen from outside inside the vagina during a gynecological pelvic floor examination. And we call it as the ectocervical parts. And opening into the center of the ectocervical parts is called the external os. Now, what is external os? External os is the opening of the door. When I'm telling that this is a tunnel, it's like a tube. Cervix is like a tube, small tube. So this tube is having two openings. One opening will be towards the uterus, and one opening will be towards the vagina. The opening inside towards the uterus, this opening, we are calling it as an internal os. INTER, internal os. And the top opening into the vagina is the external os. Okay, so there are two openings are there, in and out, and two parts are there, endocervical and ectocervical. Endocervical pH level is alkaline, acidic, around 2, and this ectocervical pH level is same like vagina, around 2.5 to 3.5. It's more kind of alkaline, not that much acidic. Okay, that's why this part is more prone to have infections, this part, transformational zone. Function of the cervix. Now you understood what is the function. Function of the cervix is opening and closing. So closing and opening during the periods, we want that the menstrual layer is shedding out, endometrial layer is shedding out. The period the blood has to go outside. We don't want the blood should be keep collecting inside the uterus. We need the room, space, the tunnels. So through the tunnels, it has to go out and out from the body. So during periods, the cervix opens a small amount to permit the passage of the menstrual blood flow. It means that this mucosa, which was present inside, it will be thin mucosa. It will create some kind of dilation. It will become thin, not thick, because of the just lack of the progesterone and estrogen, and that particular time period. Okay, so that will create some kind of softening, and blood will keep going outside. It's a liquid. Blood is a liquid. It's not a solid, which we will need dilation of the cervix. It just need an opening passage. So this opening will be given by the cervix during the menstruation. But during the childbirth, this opening is gonna go for more dilation, because baby is a solid baby. Baby has a big head. The big head is gonna go outside. So we don't want softening of the cervix. We need dilation of the cervix. Now, during this particular time period, this whole thick layer, look, this is a thick layer on the sides. So all these thick layers are gonna go for softening, dilation. They will open up. Like, assume that you are having a tight rubber band, or you are having a tight fist like this. So into this tight fist, this is the external os, ectocervical part, this is the external os, and this is a softening. And through this softening, blood will keep going out every month. And again, it will be thin. Whenever you want sperm to go inside against the liquid, it will become soft, and sperm can enter inside. So the mucus can get soft and thick, depending upon the hormones. But during the childbirth, baby is big baby. Baby has to come outside. So this particular whole cervix is it's not gonna relax. It's gonna dilate. So it will open like this, and this, up to 10 centimeter, depending upon the head of the baby. What is going on? How much structure is going on? This much of that. So this was the closing. Okay. Now, this much of dilation of the cervix will happen during the labor. That is going to happen because of the relaxing hormone. So opening and closing, depending upon the need of the body. Endocervix, yeah, okay, we done it. And another important function of the cervix is, one is the closing and opening, and the second is ability to change the pH level. As I told you, the cervix is highly acidic into nature. It's like 2, but it has the ability to change its pH level. Throughout the most of our cycle, cervical mucosa is fairly acidic, but changes in consistency by adjusting the pH level to more alkaline, a sperm-friendly level. Now, assume that if our cervix will be always acidic, so what will happen? That is now body wants reproduction. For reproduction, body wants sperm. So the sperm pH level is around 7. It is alkaline. So if the acidic nature is there, it is gonna kill all the sperm, isn't it? Whenever sperm will come into the cervix, it will kill the sperm. But what will happen? This sperm, before the sperm, we have a semen. This semen is a fluid which is given by this ejaculatory fluid given by the male, by the penis in a female body. So this semen is gonna first change the pH level of the cervix. So that is gonna shift the pH level, and it will create a pH level alkaline. So whenever we have ejaculation inside the body, it is gonna create the shift into the cervical mucosa. So the cervical mucosa, during that particular time period, it will become alkaline, more sperm-friendly pH level. The whole liquid is going to create. So that is a kind of, like if I'll throw some water on my hand here, so there will be some kind of wetness, isn't it? So this wetness is going to create some change into the tissue, the structure, the sheath. The layer will become alkaline layer because of the sperm, the semen, the ejaculatory fluid. That is going to change the consistency of the cervix. So whenever this semen will be there, okay. So once the change into the consistency, then only the sperm can move from the cervix. So this particular time period during ejaculation, our cervix is shifting. It is creating more opening also, and it is creating more alkaline nature also. And into that alkaline sheath, it will develop a sheath into the cervical region. Through the sheath, throughout the tunnel, the sperm can cross now. It will not kill the sperm. Sperm can now cross. But if the sheath is not developed, the sperm will be killed. So that's how the ejaculatory semen itself has that kind of ability to to shift the pH level of the female cervix. That's how this is the another reason why we as a female, we are more prone to have infections into the cervix or inside the uterus during the sexual activities. So whenever we are having this ejaculatory fluid, our cervix will be open up. And whenever any infection, any bacteria which is present into the vagina, that can now easily go inside the uterus. And we can have this uterine infections, more prone to having uterine infections. Or any infection can start going inside and create a damage to the internal structures. So that's why it is very, very important to have a good, healthy, behavior developed. So we should always wash the genitals before having sex. Male penis, they should always have, they should wash them, their penis first, and then have a sexual intercourse. Because if any bacteria is living on around the penis, and they will have a will start sexual intercourse. So during this time, our vagina will be more prone to have this kind of because more openings are there. So that bacteria can now very easily can go towards the cervix and towards the uterus. So always have sex, protective sex. This is why we are always promoting the condoms. To have condom, because condom is going to create a sheath over the penis. And if that condom is there, the semen will not be ejaculating. If that is not ejaculating, we'll have our safe internal structure, okay, because there's no liquid which is going to affect the ectocervix, okay. This liquid is always going to affect that. It's always going to change the shift the pH level of the cervix. But if that will be collected into the condom itself, so the protective sheath will protect our vagina. So the fluid will not be ejaculated inside the vagina, and it will not change the pH level. Okay, so that's how always the whole world is thinking, and that use condom if you want to prevent the pregnancy. I say that use condom if you want to prevent the infections inside your vagina or inside your uterus, inside your cervix, because this fluid is going to change the pH level. A lot of things in our body, the pH level, it's going to shift the pH level of vagina, pH level of cervix, and will more prone to have infections. Okay, so always have a protective sex, and sex with the clean organ. So wash your genitals before having sex. Throughout most of our cycle, cervical mucus is fairly acidic but change in consistency by adjusting the pH level to alkaline, a sperm-friendly level, by releasing fertile cervical mucus. Now, fertile cervical mucus is a chemical released by the semen, male semen, fertile cervical mucus. So this mucus, which is present into the cervix, that should be soft. And once it will become soft, then only male fertile things, sperm can enter inside the female fertile organs. And that's only female can go for fertility. This is how the name is saying, fertile cervical mucus. So cervical mucus should be soft, so the fertility can happen during the ovulation time period. Okay. Now there are two things which is making our the pH level of the cervix is shifting. There are two times when this shift is going on. One is whenever we are having this ejaculation inside the vagina. So that's the one time. Every time whenever you are having ejaculation, the semen is there, that is going to create a softening, the shift of the pH level into the cervix. The second is, it's not the semen or which is there, it is ejaculatory semen. It is just my body as a woman. My body has a release of the egg. Whenever we have an ovulation, during that particular time, the cervix pH level will be again alkaline. because body is creating the passage, soft passage, which is favorable for the sperm. Body, its own ability will shift, and our body will become more sperm friendly body at that time. So we will not kill the sperm. Our body will not kill the sperm. So our pH level will not be acidic. It will become automatically alkaline because of this testosterone, which is there in the body, as well as the progesterone and high estrogen. They will create that during ovulation day. Okay, they will create this kind of behavior. Okay. So there are two, my body is going to do that during the ovulation, and my body is going to change this alkaline nature during the periods. But male also affect my cervix whenever we'll have ejaculation. He will have ejaculation inside the vagina without condom. Semen will be there. I hope you are clear about the opening and closing of the cervix.
Yes, ma'am.
Okay. There are two conditions which we should be always careful. We should be knowing, actually we should be thorough into these conditions as a women health, as a women first, second as a women health providers, and third, when we are talking about giving our female advice and help during pregnancy. We plan some exercises also, so we should understand what type of cervix our female is having during pregnancy. So there are two conditions related to the cervix are there. One is the cervical cancers. So this is second most common cancer into the world. So we should know about the cervix, how the cervix behavior is changing, and how the cancer cells can develop there, and what is the host of the cancer cells, HPV virus. We should have a detailed understanding of cervical cancers. And after cervical cancer, if cervical cancer happened, might be stage 1 or 2, patient might go for chemotherapy, radiotherapy. That radiotherapy and chemotherapy is going to create some kind of vaginal stenosis inside. Once vaginal tissues will be tight, stenosis will be developed, structures will be tight. This female might develop some kind of tightness into the endopelvic fascia, and pelvic floor muscles also start getting tight, and that is going to develop some kind of lubrication issues also to the female, because the structure vaginal tissues will be damaged. So once the tissue will be damaged, the glands will be damaged, the structure will be damaged. So even the cervical glands will be damaged, the lubrication will be issue to the female. So cervical cancers has a lot of effect in a female body, and as a women health physiotherapist, we might have a referred patient from any a gynecologist or oncologist that the female is going through the cervical cancers and chemotherapy is going on, and vaginal stenosis she developed. So too much of adhesions and too much of tightness and lot of lubrication issues, dryness issues she has. So we can help as a physios. So we should understand cervical this condition, cervical cancer condition, and how to do rehab, how to relax the areas afterwards. Okay, we should have this understanding. Second is a cervical incompetence. So cervical incompetence means cervical length, or cervix, the organ itself is not competent. It's like it's incompetence. It's not sufficient actually. We also call it as a cervical incompetence, or we also call it as a cervical insufficiency. So cervix is not sufficient to support the pregnancy actually. So what does it mean? It means the length of the cervix is not good enough. It is short cervix. If the short cervix will be there, and how it is going to affect, and you might have heard this during in pregnancy when we are planning the exercise, the contraindication of the physiotherapy, cervical incompetency or insufficient cervix. Have you heard about this condition? Yes.
Yes, ma'am.
Okay, so what it is actually, we have to understand these two conditions, and let's understand the first one, cervical cancer. Girls, you want to have 5 minutes of break? Yeah.
Okay.
Yeah, let's have a 5 minutes of break, and then we'll continue the session. We'll understand the conditions. And
Okay.
now, if you have any question, you can write down in the chat box. I hope the session is going good. You are understanding.
Yes.
Yes, ma'am.
Yes, ma'am.
Okay.
Okay, thank you.
I'll see you after 5 minutes. It's right now I don't know, your time. Yeah, I'll see after 5 minutes. Yep. Bye-bye. Hi, everyone. Yeah, okay, you are there with me. Shall we start?
Yes, ma'am.
Okay, all right. So we were discussing about function of the cervix and conditions which is affecting our female cervix specifically. So what first thing which can affect the tissue of the cervix is the cancerous cells. And second is itself how, what is the length of the cervix? Normally, the length of the cervix should be, as I told you, 4 centimeter. Okay, that's the good length of the cervix. But if your USG reports are telling that cervix length is shorter than 4 centimeter, so the normal length of the cervix is this one, 4 centimeter. Okay, during the pregnancy, it is very, very important to know. So next time, if you are like you're a physiotherapist who are supporting a female during the pregnancy, and your patient will come to you, the first thing which will observe is her USG reports, and into her USG reports, what is the length of the cervix? That is the first thing which we have to always look into. Okay. So if the length of the cervix is 4 centimeter or more than that, it means the cervix is long enough. And they might also have a good length is there, supportive length is there. It means structure of the cervix is good. And if the length of the cervix is less, it is around only 2.5, 1.5, 2. So that is a short cervix. So, and this particular length, very important to understand or notice during the 20 weeks of gestation. It means during the 4th month. And after 4th month, we know the baby is going to develop and more pressure of the baby is going to fall over the uterus, this the cervix, because baby is going to develop here. So more pressure will build up into the uterus, more weight will fall into the downward part, and that is going to compress it downwards. So after this 20 months, 24 weeks, 20 weeks, 24 weeks, every passing month, we should keep checking the cervical length. The cervical length should not go down. Okay. If it is going down, this is how we have to uh, like see that which position is not good for our patient. If the cervical length is very small, 1.5, 2.5, it is smaller than 3.5. So then in these cases, doctors might tell, they will keep observing the cervix. By after passing month, they will observe the length is going down or it is the same. If it is going down, they might tell your patient to stop exercise. Why? So this is the structural deformity is there. Insufficient, cervix is insufficient to support the pregnancy. So in this case, doctors will tell that don't go for exercise, stop exercise. What is the reason? Or even our books are also saying as a physios that
Early labor.
uh, early labor, okay. What will happen? It can, there are chances that it will open up because of the small size.
Yes.
Yes, so there might be chances that once the baby will keep developing, the weight of the baby will increase, that will fall downward. So if the weight will fall, it might open up the cervix, it might dilate the cervix at an early stage. And we don't want that. And this can also start showing some kind of liquid discharge might start coming outside. Some bleeding can also start coming outside. So doctor don't want to give any position to the patient which will put the weight of the baby over the cervix. So standing position or sitting position is the position where the weight will fall downwards. So they are gonna avoid direct completely gravity action. So no intra-abdominal pressure should fall downwards. No gravity should pull it downwards. So they will try to protect the cervix and they will give that position to the female through which there's no pressure is falling over the cervix. They will put the female into supine position. They will let her to, not a supine position, they will ask her to just stay on the bed. Don't get up. Stop your activities. Stop exercise. Don't do exercise also. Now, can you understand why the doctors are telling them? And why it is written in our books? Don't go for physiotherapy. And as a physio, it is contraindicated. We understood that? This is a
Yes,
structural
ma'am.
deformity, and we can't do anything. If doctor will find out the cervical length is very short, it's like more than less than 3.5, and even less than 3, they might go for a cervical circlage. They will observe the female and they will close the cervix from downwards. So they will do this kind of circlage. They will do apply stitches around the cervix over here through the vagina. They will create a clamping of the cervix. They will close it, and they will ask the female to lie down now. Don't get up. If she will get up, she will sit down. She will stand into sitting. Internal pressure will fall downwards over the cervix. Weight of the baby will fall over the cervix. There are chances of the cervix to open up. And if the female will go in a standing position, gravity will also keep pulling it downwards. So there are more chances that of the cervix might get open and dilate. This is a life-threatening condition for the baby. Many miscarriage happens because of the cervical insufficiency. Some females, when they miss, they're bleeding. The first sign of cervical insufficiency is liquid. Liquid will, some kind of amniotic fluid will start coming out in a more like during the 4th month, 3.5 month, 4th month. When baby will start developing, the pressure will start falling. Now cervix is not sufficient to support that. Now the mucus will open up because of the loading, and through this there might be liquid amniotic fluid will start coming outside. So the first sign is liquid will start coming out from the vagina into end of the 3rd month or starting of the 4th month. The second sign can be the bleeding. Once the pressure of the baby is falling downwards, that might that because of the pressure, there might be some kind of capillaries, which is some capillaries which is present. They might start kind of piercing actually because of the load. And the cervix, internal cervical whole tissues and cells, we should go for thickening. They are not creating the thickening. They are stretching out. The tissues are stretching out. Cervix is dilating. And because of the dilation of the cervix, internal uterus isthmus part is gonna go for stretching. And this stretching can create a dilation and tearing of the arteries, small arteries. And that can show some blood also coming out from the vagina. So bleeding, and the second is, the first is the amniotic fluid, liquid, and the second is the bleeding. There might be 2 signs. And if female will miss that, they might be automatically, because cervix is very, it's not supportive at all, they might open up and dilate, or like, without giving you any notice. And sudden dilation can pull the baby downwards. And this can be the life-threatening condition where baby will out, miscarriage. It is a one reason of miscarriage during the 4th month. So when we are starting exercise, we normally don't start exercise into 1st trimester, into 3rd month, because in 3rd month already the internal organs are developing of the female. They are getting ready for the gestation life of the baby. The body is getting ready. Female body is getting ready. The fluids are, the consistency of the fluid is shifting. Mucosa of the body is shifting. The hormones are getting bigger. More development of the placenta is going on. More progesterone will come because more developed. Placenta was very small during the first month, 2nd month, 3rd month. It will start developing more bigger into size. After the end of the 3rd month, it will be completely developed placenta. When the placenta will be completely dilated, so more good progesterone level will be there in a female body. Better before even in 1st trimester, during this particular time, most female, they are supported by the gynecologist by giving them progesterone hormone, external hormones they are giving, the progesterone, so that there should be good hormone progesterone closing effect into the body, because still progesterone is not developed. But after that 3rd month, progesterone, this placenta will develop, so better progesterone level will be there, and this progesterone is going to be supportive hormone that will close the mucosa of the vagina. Also, it will create the thickening of the vaginal this mucus kind of structure, that will create a thickening of that. And so it's very important that we as a physio don't unnecessarily start exercise into first trimester if it is no need of the patient. If patient is sent to you by doctors because of some conditions, might be the female is having breathing difficulty, so in first trimester, so we should only give them breathing exercises, not unnecessarily this jumping exercise and if there's no history, female is first time pregnant, we don't know what type of cervix she's having, there's no history of previous birthing, so we don't know her what type of cervix she was having previously. So we should avoid giving exercise into first trimester and always check the length of the cervix. If the length of the cervix is good, there is the second question is which we have to ask our female, is there any vaginal discharge is going on? If the answer is no, no discharge, is there any time she noticed some kind of bleeding coming out from the vagina? No, there is no bleeding at all. Then we can start slowly the exercise. But still, 4th month is a very careful month because up to 5th month, we will know that how good strong mucus is given by, how good strong support is given by the body. So cervical insufficiency is one condition which is gonna develop up to 4th and 5th month. Okay, we will get to know, doctors will get to know that what type of cervix she's having through this USG reports. Okay, so when the patient is coming to us, we will always check this cervical length. And if she has a length less than 4 centimeter, and then we should not give her any exercise. In which position? Should we stop exercise? Completely avoid exercise, or we like contraindicated? Exercise is contraindicated. Is this the right term which is written in our books?
No, ma'am.
So what should be the right thing?
We should not give exercises in standing or weight bearing positions.
Very good. Absolutely correct. Yes. So exercises, physiotherapy is not contraindicated. Exercises, physiotherapy is with precaution. Okay. So as she said, that exercises should not be given in weight bearing position or sitting position or standing position, or avoid gravity, avoid intraabdominal pressure, avoid sitting. And so there should not be any position given to the female where the weight of the body will fall over the cervix. So otherwise, all other positions we can give to the female. All the exercise of upper body, thoracic, you can give her back exercises, you can give her neck exercise, you can give her shoulder exercise, you can give her hip exercise, you can give her leg exercise, you can give all the exercise, but not in sitting and standing. Then what are the other position? Other position which will put the pressure away from that cervix. So like pelvic bridging. So pelvic bridging will be very good for the female. So in this, the weight will not be over the internal os. It will be away from the internal os. We can give exercises to our female in sideline position, right sideline position, left sideline position. We can give her exercise into quadruped position, but not into the sitting position and a standing position. Clear, everyone? And exercise are not contraindicated. She needs exercise if she will go for complete bed rest during 4th and 5th month. So you can understand that still there are 5 months to 4 months to spend. And during this 4th month, she might develop lot of other issues, back issues, edema, circulatory issues, many things she will develop in her body, and backache issues will be there. And so it's not good. She has to do exercise, but in a safe position. So as a physio, we should understand cervical length. Clear? I hope it is clear. Doctors will do this kind of cerclage correction to the cervix. They will do the kind of they will apply some stitches or some kind of band, cerclage band, and they will ask the female to now avoid the standing and intraabdominal pressure. And then during this particular cerclage helps prevent premature, because if the cervix will open up, cervix is kind of a short cervix, there might be chances it will open up suddenly and without giving a prior notice to the female, and that might create an unnecessary miscarriage or other complication to the baby, because baby will not be developed before prior to this 32 weeks. So this premature baby birthing can be also, the chances of that can be there also. So incompetent cervix poses risk for your pregnancy, particularly during the second trimester, okay, starting of the 4th month and 5th month. So second trimester is very, very important trimester where we should be more careful as a physiotherapist, including premature birth or even pregnancy loss, miscarriages. Circlage is the thing which doctors are gonna do to prevent the premature birth. They will find out the female is having a less, this kind of things are going on. They will do the circlage, and during the procedure, the cervix is stitched close to help support the weight of the baby and prevent preterm birth. Circlage are recommended in these cases and for mothers with history of preterm deliveries. So history is also very important when your patient will come to you and she's a second time mother, third time mother. So was there any time she had a preterm delivery chances, and what was the reason of preterm delivery? It is very, very important to have a detailed history of your patient. Okay. And an incompetent cervix, also called as a cervical insufficiency, occurs when cervical tissues and mucosa is very weak. It is a structural problem. We cannot do anything with that as a physiotherapist. Doctors can do, obs and gynec, they can create a circulage around that. And in this condition, the mouth of the cervix opens without notice and baby can slip out of the womb. This usually happens around 5 to 6 months of the pregnancy, and the weight starts increasing during this time. So during the second trimester. So I hope you are clear about this. Okay, girls?
Yes, ma'am.
Any question?
No, ma'am.
We'll discuss more about that, which exercise, how to do in pregnancy time period. Okay, pregnancy sessions. All right. Next is the cervical cancer. Nimisha is asking, ma'am, please repeat that after function of the cervix. What do you want me to repeat, dear?
Ma'am, some part was missed.
There are two functions of the cervix. One is the closing and opening.
Yes, ma'am.
It's of the mucosa which is present inside the central part, that is going to soft or thick. So when we want soft during periods, when we want soft, when we want to get pregnant during the ovulation time period, isn't it? We want it soft. When we want it open during the childbirth, during the labor time period, we want it open up. Otherwise, most of the time we want closed cervix. So the infection should be outside. Another function of the cervix is the ability to change the pH level. So our own body ability, our body as a woman, that during ovulation time period, our cervix will have those kind of hormones, which is going to create the softening of that. Okay, during ovulation time period, during periods when we have a blood and blood has to go outside. So our body required this passage. So at that time, our this pH level of the cervix will become alkaline, 6 or 7, more blood friendly, because our menstrual blood, that is alkaline into nature, that is around 7. And same way, the sperm is also 7. So during these particular 2 time periods, when the blood is going on, we are menstruating, or when the sperm, the body required sperm, ovulation, or when the sperm is already there, the semen is already there, are this pH level of the cervix is going to shift from the acidic to more alkaline. Okay, and that is the reason why during the periods, during the sexual activity, our body is more prone to have infections. Okay, and we can save it by wearing a condom. So condom can prevent unnecessarily effect from the other organ, from this fertile cervical mucus, from the semen. The condition which affect that is a cervical incompetency. So cervix is not of a good length. The structure is not supportive structure for the loading. Okay, so that's the problem which we can see during the pregnancy. And that is a kind of that can give premature birth or life-threatening position for the baby. Miscarriage can also happen. Clear, dear?
Okay, ma'am. Clear.
Second is a second condition which is very, very important. I really want all of you to work with me in this particular awareness. That is a cervical cancer. And cervical cancer is the second biggest cancer which our females are going through in their life. And another thing is, after cervical cancer, if the female find out that they have a cervical cancer and they are undergoing those kind of therapies, those females get lot of issues into the vaginal area, kind of dryness, it can be tissue damage, skin damage, it can be that tightness into the adhesions between the two organs with each other, that fornix, anterior fornix, adhesion between the anterior fornix and posterior fornix, that particular skin of this vagina and the cervix. And because of the adhesion, female can have lot of difficulty whenever they need a room to expand. So vaginal expansion will be not good. So sexual pain will be very, very common to the females. When she'll go for arousal stage, this kind of deep pelvic pain will come into picture. Chronic pelvic pain can also come. So pelvic pain will be one reason of those kind of cases. And because expansion of the vagina will be kind of somewhere compromised because of the tight tissue. The fornix will be tight. They will develop those kind of, we call it as a vaginal stenosis. Vaginal upper 2/3 part is responsible for this lubrication, but this vaginal upper part, we have lot of blood supply, so that whole arteries, the veins, that whole system, circulatory system, draining system, that will get affected, that will be damaged because of the radiations, and that is going to create damage to the upper part of the vagina. So that will be not functional vagina. So if the functional vagina means the lubrication will be less. So what is the function of upper part of the vagina? Secreting the lubrication. So lubrication of that particular area will be now compromised. So there is no lubrication, and female can start having this kind of dryness issues developing. And upper 2/3 is also responsible for the lactobacilli bacteria that is staying there. But if the upper part is damaged, of the vagina is damaged because of the radiations, so that healthy bacteria cannot sustain, because the ecosystem will not be maintained. If the bacteria is not there, ecosystem will be not maintained also. So that vagina will be more prone to have infections also. So now chronic pain, vaginal elasticity of the vagina is going to compromised, tissue of the vagina is going to compromised, vessels and blood capillaries are going to compromised, even the skin will become very, very kind of tight skin structure around that, fornix around that will become tight structures. And even endopelvic fascia, pelvic floor fascia muscles will also start getting those kind of tightness. So dryness, pelvic pain, tightness, discomfort, more prone to have infections. These will be the common complaint of our females after chemotherapy. And we have a big role as a physiotherapist in vaginal stenosis and in increasing that the vascularity of the vagina after like post cancers rehab actually. And if the pelvic floor muscles are tight, if structures are tight, if ligaments are tight, we can do very good things with our hands-on techniques, like by stimulating that area, by massage techniques, by giving them kind of will not say that steaming, but by this kind of sits, some kind of techniques like massage in transvaginal tissue massage. Many things are there which we will keep discussing in upcoming sessions. But cervical cancer is that cancer which is going to affect our female up to a great extent. And if that is affecting, we should understand why it is very common nowadays. And prevention is always better than cure. We are talking about the rehab, but rehab is the part which is going to come after the cervical cancer is happened. But can we do something that we can prevent the cervical cancers? And can we understand? So for that, we have to first understand the cervical cancers. So now let me understand cervical cancer first. What is the cervical cancer and how it happens? Cervical cancer is a cancer which happens to the cervix of the uterus. It start happening around this region. And the cause of the cervical cancer is HPV virus. The full form of HPV virus is the human papilloma virus. When we're talking about the cervical cancer, it is the most common problem. Is the second cause in female cancer death, and second leading cause of cancer deaths in women age between 15, I will not say 15 to 14. That is wrong actually. It should be, I will say that 30 to 50. 30 to 50 is the right. 50 or 55 is the right age. This is the age, not 15 to 45. Okay, I'm so sorry about this. So now another thing is, if I give you the statistics about India, 67,477 deaths annually. Okay, so approximately 185 women die every day. Approximately 8 women die every hour. We got a woman dies every 8 minutes. We had a break of 7 to 8 minutes, isn't it? In that particular time span, one woman already died because of the she died because of the cervical cancers. If 12,000 women are diagnosing with the cervical cancers, out of 12,000, 4,000 confirmed deaths are there. So mortality rate is very, very high actually. So very, very sad to say. The cause of the cervical cancer, how the cervical cancer is spreading, from where it is coming, from where this virus is coming, and how we are getting affected. So the cause of the cervical cancer is human papilloma virus, or HPV. And you know, girls, where HPV virus, who is the host of HPV virus? Who is the host of HPV virus?
Males.
Male penis, yes. Male penis is the host. So when, how many of you are sexually active? I don't know. Like I'm sexually active. I'm a mother. I'm married since many years. So when I had my first intercourse in my life, at that particular time when the penis entered in my vagina, so the HPV virus entered in my vagina. When the penis entered without the condom, then the male penis tissue, the skin touched my cervix. So that is the time when first time HPV, human papilloma virus, entered in my vagina. Depending upon who is strong, whose immunity is strong, my vaginal tissues are strong, my immunity is strong, or the virus is strong. This is how that is going to affect my body. If the HPV is strong, it is going to affect the cells. If the women's immunity is strong and women, what we are saying, yeah, women's HPV, women's immunity is strong. We have a fight, our cells are more stronger than the HPV cannot develop. Okay, so this is depending upon with how many of different type of HPV entered in our body. There are altogether many types of HPV. So your homework is to do types of HPV. You just go through that, how many types of HPV is there. Out of those, whatever types of HPV are there, different types, there are 2 different dangerous type of HPV. If I'm not wrong, HPV 9 or HPV 16 or 17. There are the 2 types, 9 or 17. They are the dangerous HPV types. And they are the virus which has the ability to damage the cervical cells of our of women. Okay, if we don't know our partner penis is having what type of HPV out of all those types, so like it is having HPV 1, 2, 3, 4, what type of HPV is present on your male partner, we don't know, isn't it? So if that 9 type of HPV is present, so that might gonna affect my cervical cells. And another thing which is going to affect is how many different type of HPV entered into my body. So how many type, like, am I I'm doing sex with a single person, or I'm doing sex with the multiple, I have a multiple partner. If there's the multiple sexual partners are there, so might be in multiple sexual types of the HPV are going to enter into the body, and out of that might be one is dangerous, and that is gonna, that type of human which is having human papilloma virus, so that particular type is going to affect your cervix, so that might give you cervical cancers. And so multiple sexual partner, whenever we are having, we are vagina is more, our cervix is more prone to have access to different types of virus. And so I can't say that, like, we cannot prevent sex, we can't prevent intercourse, because reproduction is our nature. We want to become mother one day, we are sexually active, and the sexual functioning is very, very important aspect of our life. We cannot stop it. That's how that then, but prevent, if if I'll have sex, my body will develop it, my body will have the excess of HPV will enter in my body. Now, depending upon if what type of HPV entered, and the second is if how strong is my what this immunity, how strong is my immunity to fight against that HPV. So the both things are affecting. And this third is, now, if what we can do is, the third is very, very important about this, that this is a virus which is having a very slow development. It's not something which will affect you and show you symptoms within a month, within a year. This virus is gonna develop and gonna take a long time to develop. It's gonna minimum 10 to 15 years. It will take to show you result. So if you check yourself, there might be cells present on the cervix externally, this actocervical part, but that will not start developing inside this actocervical part, okay, the internal part, endocervical part, sorry. So that might start having this only on this, the cells are present only on the outer sheath, which is present into the vagina. They will not be into the inner part. But if they will start the development inside the part, they're gonna take years into that development, and minimum 10 years actually. So when I had my first intercourse, when I was, for example, 12 years before, 14 years before I started my sexual activity. So now this virus is gonna show me the symptoms now, after this 10 to 15 years of sexual activity. All of us, if you are just sexually active since 1 year, 2 year, oh, your body will not show any change right now. The body is going to show you change after 10 years. Okay, so the HPV which we detect today, if you just got that you started having HPV symptoms, so that could have been acquired years ago, 10 to 15 years ago, when you had your first sexual activity. That is a sign which is coming from that particular time period. Okay, so that is living on the male penis. Male penis is the host of HPV. So, and depending upon number of factors, number of the sexual partner, age of the female, weakened immune system, kind of complete damaged skin around the vagina, around the cervix, infections going on around the cervix, they all can be the more bigger factor. Important cause is just HPV, but more factors can be there. Unprotected sex, when we keep having sex with the multiple partner, unprotected sex, that can give our body access to this kind of HPV. Early marriage. Why early marriage? Because early marriage, when we are getting married at the age of 14, 15, we start having this kind of relationships. At that time, our immunity is not strong enough to fight against this kind of HPV virus. So if our mother, our grandmothers, they used to get married at the age of 15 and 16, they might be diagnosed with this kind of issues very early in their life, because they started their sexual activity, or not our grandmother, anyone who start the sexual activity at the early age. 15 or 16. So they might start, the body will start showing them signal at the age of 30. So they might diagnose with the cervical cancer at the age of 30. Instead of that girl who started her sexual activity at the age of 25. So the female who started at the age of 15, the body will show the symptom within when she will be 25 to 30. But if the female is started her activity at the age of 25 and 30, so this female is going to diagnose with the cervical cancer at the age of 40 and 45. So more early sexual activities means more early you will be diagnosed with the cervical cancer. There might be chances that you will have this diagnosis. And even early childbirth, when your body is gone, your immune system is not strong, your vagina is dilated, your vagina tissues, cells are getting exposed to that external environment, your cervical tissues are keep they keep getting deliveries again and again. So this what transformational zone, which I was telling you, that zone between the cervix and the vagina, the cells will be more weakened cells, and that can also affect more deliveries. Oral contraceptives, when we are having the females who are having consuming a lot of contraceptive devices, this not devices, this contraceptive medications, so they are the external hormones. So my body is under effect of extra hormone always. So those hormones might dilate the cervix, might efflage the cervix, might affect the cervix, mucosa of the cervix. So it is always affecting the hormonal level, and oral contraceptives are there who's creating the weakness into the cervical cells. And family history, sometimes the family history is there, like my mother was having those kind of cells in her cervix, which was not a good cells, or might be into the vagina and into the cervical region. And the second is a smoking. Smoking has a very big role into the cervical cancer. Why? Because smoking is going to create that damage to the mucosa of the cervix. So that is also under effect. This mucus, the thick mucus, will be always thin. That's why they are saying that during pregnancy, the female should not have a smoking, because the chances of cervical incompetencies will be also high in those cases. And the chances of getting this mucus, which is created by the body, the mucus will become thin mucus because of the smoking. That has an effect on our body, and it affects our immune system also. So there can be multiple other factors, but the main cause is HPV virus. And the symptoms our body will show after some times, after 10 to 15 years. And the symptoms can be anything, like, depending upon which stage of life you are into. If you are only 30 years of women, you might start feeling that whenever you are having, you might start having this kind of sudden weight loss in your body. Suddenly weight loss is there. You might start having swelling into your leg, a lot of backache issues, pain during sexual activities. You have a periods going on, you have a fixed monthly cycle. Every day you are bleeding on one fixed date, your menstrual cycle is coming out, but you are bleeding in between also, in between your days also. Some kind of bloody mucus is coming, some kind of smell is always there into that kind of liquid which is into the which is coming from the vagina. More kind of foul smell is there, darkish color is there. It's not a red color, it's like a dark brown color of discharge is there. Sometimes you are thinking that the blood is coming after whenever you are having sex is painful for you. Some kind of pelvic pain is going on. When your body is going for arousal stage, your vagina is creating this kind of lengthening. The lengthening of the vagina is giving you stretching pain inside the pelvic region. Whenever your bladder is full, full of the fullness of the bladder is going to put loading over the cervix posteriorly. So the tissue of the cervix will get stretched out. So you might have pain during the urination, or when you are not during urination, when your bladder is full. So at that time, you might have the pain. When you have a hard stool present around the rectum, the pressure is there, around rectal pressure is there. Rectal pressure is putting your pressure over the cervix. You might have pain during that time also, pain during urination, pain during defecation. Sometimes pain during sexual activity will be very, very common. And arousal phase, penetration, they will be painful. Lack of lubrication will be there, and bloody signs in between the monthly cycle will be also visible. Sudden foul smell, sudden weight loss, and back pain issues, leg swelling. Why back pain issue will be there? Because the uterus is having a connection with the sacrum. Cervix is having a connection with the pubic symphysis. So we have a ligament which is supporting the cervix, pubocervical ligament. If the cervix is damaged, the ligaments is gonna be damaged also. So that might give you the pubic symphysis pain as well, or back pain or issues as well. Might be uterosacral ligament is also get infected. So other ligaments can start getting infected, and they can give you back pain or pubic symphysis pain or abdominal pain or bleeding, different type of bleeding during different things. So they all can be the symptoms of cervical cancers. Okay. Now, what is the diagnosis? How to diagnose? I always believe, and I always try that, we should try to educate the society that stop wearing dark clothing. Don't wear dark color of pants or panties, actually panties I'm talking about. Because whenever we are wearing dark color of panty, we might miss some fluid sign. So we should know that by wearing the light color, like light pink, light peach, those kind of white color panty, if you are wearing a cream color panty, if you are wearing, so whatever discharge is coming from the vagina, we can always observe at the end of the day, okay, what is the vaginal secretion? So this light color panties are gonna give us that complete things, what is going on inside the body. The color of the discharge is very, very important. We should not miss the color of the discharge, and we should not miss the smell of the discharge. And whenever we found the color of the discharge is wrong and the smell, if foul smell is there, we should definitely go and visit a doctor. Sometimes we avoid visiting these gynecological consultations. Please don't avoid it and go, and if you found some bad color, bad foul, visit your doctor immediately. And the right thing is pap smear test. So doctors, what they will do, they will look at the structure. There might be some other cause, or if there's no other cause, everything is fine externally around the vulva, around the vestibular region, around the vagina. They will check inside around the cervix. They will take a tissue outside. They will send they will collect the fluid, and they will send the fluid for the they will try to check like what type of, if there's some kind of tissues are developing or not. Pap smear is very, very important. They will also do pelvic examination. They will look at the structure with their tools, that if there's some kind of damages going on around the cervix or not. So physical examination and history, doctors will take your history. They will check you, they will touch your areas where you are having pain. The thing is pap smear. Pap smear is the best thing. And after pap smear, they will send it for that laboratory, and they will see that the cells are developing or not developing. The virus is active or not active. If the cells start developing, they might treat you accordingly, because there are different stages of cervical cancers. I'm going to play one video for all of you here. Let me just stop here. Where was the video? There was one video. Let me show where is it. Let me see where it is. Okay, yeah, it is here.
Do you know what will happen if you read one book every week? Let me share some.
Okay, girls. Just be with me. I'm playing for you. Here. Okay, girls. Can you see the screen? Visible? Visible?
Yes, ma'am.
Okay, I'm playing it.
The staging of cervical cancer refers to the extent of the disease. Doctors stage the disease according to the size of the tumor and whether it has spread to nearby tissues or other organs of the body. Stage 0 is not considered invasive because the cancer cells are found only in the top layer of cells of the cervix. Stage 1A is considered invasive cancer because the microscopic tumor grows through the top layer of cells into the underlying cervical tissue and is 3 to 5 millimeters deep by 7 millimeters wide. Stage 1B cervical cancer has two scenarios. One, where the tumor still can only be seen with a microscope, but is larger than 5 millimeters deep and 7 millimeters wide. In the second scenario, for stage 1B, the cancer can be seen without a microscope and is larger than 4 centimeters in diameter. In stage 2,
This is what your gynec is gonna see during the examinations. So they will look the cervical region, and they will found this kind of tissues visible into the cervix. Skin tissues will be kind of damaged, and that can be the reason why you are having this kind of things. Okay, so the gynecological examination will find out this stage.
2A, the tumor spreads beyond the cervix to the upper 2/3 of the vagina, but not to the tissues around the uterus.
Look, in this you can see that tissues are not going towards the cervix, they are coming towards outside. All the actocervical part as well as the vaginal upper 2/3 tissues, they are getting damaged. So this is also be seen during the gynecological examination.
In stage 2B, the cancer spreads to the tissues around the uterus. In stage 3A, the tumor spreads to the lower third of the vagina.
Look, more like later we will find out more damage the tissue will be. So that is very important that we should not like miss any symptoms of bleeding and pain and some foul discharge. Whenever these three things are there, please go and consult your doctor.
In stage 3B, the
Ma'am,
cancer
please
spreads to the
Yes, ask.
repeat, ma'am.
Yeah, okay. Repeat this video.
Yes, ma'am.
Okay. Look, again, see, the tissues were completely fine. This is the right cervix. Cervix should be like this. So all of us, we can do the self-examination. You can keep touching your cervix. If the touch of the cervix is giving you some kind of pain and discomfort, it means something is going on. And whenever you are touching it, you smell that. Bring your finger outside and smell that. Liquid. So what is it? A foul smell which is coming from the vagina. If there is no foul smell, that is your vaginal smell, so it is okay. And but if you found some foul smell is there, and then definitely and some bleeding is also there, please go. So this is the right structure which is there inside the vagina. This is the in external os. This is the vaginal tissue on the sides. This is a cervix, and this is central part, external os. So this external os should be safe, and nothing is there. Look, and now this tissue will start developing here. Look, now compare that. This is a stage 1B.
a microscope and is larger than 4 centimeters in diameter. In stage 2A, the tumor spreads beyond the cervix to the upper 2/3 of the vagina, but not to the tissues around the uterus.
Now assume that your doctor find out that you are suffering from cervical cancer, and that is stage 1 is going on, stage 2 is going on, when it started spreading not only around the cervix, but around the vagina also. So the treatment which they are going to do is a chemotherapy or radiations. They will give you radiation, and they will damage all these tissues. So they are damaging the vaginal tissue, vaginal internal mucosa. So vagina will go for a kind of complete that will develop tightness and stenosis, and that will not be the vascular and functional vaginal. Upper part is present, but that upper part will not be functional part, because the arteries which was present, which was coming, the ending, which was supplying the vagina, the veins which was supplying the vagina, they will all damaged because of the chemotherapy. So the damage of the arteries and the vessels and the lymphatic system is going to happen after the chemotherapy. Now you can understand why your female is having pain during the sexual activity, or she's having the dryness issues in always, and more prone to have infections also. Clear, girls? So we have a role here as a physios. We will understand, and we have to help our female after the rehab. But we cannot give her heating, because if you start giving her heating, it can unnecessarily elevate the cells again. So we have to avoid the heating. But yes, We can give them cryotherapy inside the vagina. We can massage the females. We can try to relax the pelvic floor muscles. We can try to relax the abdominal tissues which are going for the adhesions, which are developing the adhesions. Try to improve the blood supply towards that area. Give exercises to the female which bring blood supply towards that uterus, towards the all this vagina and the vulva. Will give IFT to the female. Interventional therapy is also going to helpful for the female to improve the blood supply toward that region. We'll give massage to the vibrations. Vibrator therapy is also very, very effective. So anything which will improve the blood supply to the region is our responsibility as a physios. Okay. Okay, we'll discuss about the rehab part later on, but you understand that what is going on with the cervical cancer.
In stage 2B, the cancer spreads to the tissues around the uterus. In stage 3A, the tumor spreads to the lower third of the vagina. In stage 3B, the cancer spreads to the pelvic wall, the lining of the body wall cap.
Now here you understand that what happened here. The whole pelvic floor muscles also came into picture. So it was a cervix, then lower part of the vagina, lower part of the upper part of the vagina, then it was uterus, lower part of the uterus, then it started bringing the whole vagina into picture. Vagina is going to come in relation with the pelvic floor, levator ani, and endopelvic fascia, the whole levator ani. This is the levator ani muscle, this one, endopelvic fascia. So this fascia will also be get involved, and through this fascia, not only the vagina which is going, which is passing, even urethra is also passing anterior there. Posteriorly, the rectum is also passing. Rectum is also there. So because of this fascia, the rectum, anal canal, rectum, urethra, bladder, everything will come into picture. Okay, the more severe stages of the cancers are going
between the hips, or it may spread to the uterus, tubes that carry urine away from the kidneys to the bladder. If the flow of urine is blocked, the kidneys can become enlarged or stop working. In stage 4A, the tumor invades nearby pelvic organs, such as the bladder or rectum, and may spread to the pelvic lymph nodes. In stage 4B, the cancer spreads past the pelvic lymph nodes to other places in the body, such as the liver, intestines, or lungs.
So you can understand here that more severe stages we will find out. It will be more harder for us to control the cancer. Not for us, but the doctors. Actually. Okay? And more complications that is going to show. So no cancer, stage 1B, stage 1, late stage 1B, and then this is the final stage when it's spreading everywhere. So more early we will detect, more safer we can still save our female. Okay, so this is very, very important. Let me. Okay. All right, no problem. So you understood this slide?
Yes.
Yes,
Vital
ma'am.
cancer stages, yes.
Right. Okay. So next is the treatment. What is the treatment? So more early we'll detect, more safer we will be. So the treatment is chemotherapy or radiations, or might be the combination of chemo and radiations, or the surgery. They might remove the organs. If the cancer is spread into like the cervix, it is around whole cervix is involved. They might take the cervix outside. Or if whole like what we will say vagina, the uterus is involved, they might do that hysterectomy to the female, but they cannot remove the bladder, and they cannot remove the kidneys, they cannot remove those things. So more like severe stages, there are chances that they can't save the female. That's how most of the female, they ignore the this pain, sexual pain, and they ignore this discharge, and they don't go for a gynecological examination, and they might end up into towards this third stage and fourth stage, last stage of the cervical cancers, where it is hard for the doctors to help them. and they might, this is what we say that out of 4,000, 1,000 is going to die because they diagnose at a very later stage in their life. Okay. So what is the treatment of HPV? Prevention. Okay, prevention is the best thing. Girls, just be with me. My dog is barking. Just give me 5 minutes. Okay, and then you till the time you just please read this slide.
Okay, ma'am.
Okay, have you gone through this slide? So the right is that we have to prevent it. And how to prevent? We cannot stop sexual activity. So we know that it is important for our life. So, but if we can do vaccination before having sexual activity, before being sexual active in your life, please have vaccination. Any one of you who till yet who hasn't started sexual activity, please vaccinate yourself before having your sexual activity. Once you are already sexually active like me, then please have HPV, please have pap smear every 2 years or 3 years. If you are into the age between 20 to 30 and you are sexually active, so have your pap smear every 3 years. If you are into the age between 30 to 40, so have pap smear every 2 years. And if you are age above than 40, please have pap smear every year. And this pap smear will give you early detection that your body is going through those changes or not, the virus is developing or not. Okay, so every year, please have pap smear. That is a prevention. What I do in my life, on my birthday, before my birthday, I always do pap smear. And I try to have this result, this test done before my birthday. So please, all of you, do this favor to you and have your pap smear. And if you're a mother of a girl, so or a boy, so please give them HPV vaccination, because nowadays they are involved male to male sex also, or oral sex is also there. So so please make your female or make your male vaccinated for the HPV, because vaccinations are available. They are into the nowadays, and WHO recommends that every kid between the 11 and 12 years old, they should receive the doses of HPV vaccination, 2 doses of the HPV vaccination if the age is between 11 to 12. Why? Because body is still going through this puberty time period. Body didn't develop this menstruation. But after they have this, after 15 years, when body is completely developed, it is important that they should have like after 15 years, it is 2 doses, and before 12 years, it is only 1 dose, which is important. So sorry, before 15 years, it's 2 doses, and after 15 years, it is 3 doses of vaccination. But vaccinations are not effective if you are sexually active. Okay, so that is very important. If you ever had sexual activity in your life, penetrative sex with the penis, So please keep having your pap smear. That is the only solution. And if you never had you never had sexual intercourse, so please vaccinate yourself. Doesn't matter if you are 40 years old and you never had sex, go for vaccination. That is going to be effective. Prevention is best care. And now you can understand the tissue damage. According to the tissue damage, how much, what can be the role of physiotherapy, rehab, and this is we are going to discuss tomorrow. All right, girls, I'm stopping here today. Yep.
Okay, ma. Thank you so much.
We'll have the rehab part tomorrow.
Okay.
Thank you
Thank you, ma'am.
so much, dear. I
Thank
hope-
you so much, ma'am.
Okay. Did you? How was the session? Good. You learned something out of it?
Yes, ma'am.
Yes, very educative.
Thank you. Thank you so much. And I really want you to give best from my side so you can help a lot of female in your life. So start creating the awareness about pap smear in people around you, and tell the mothers, educate the mother to give their vaccination to their daughters and their kids. And yeah, the women's who are married, tell them to have a pap smear. It is important. Save them. Tomorrow we will discuss about uterus, and we'll understand the length of the uterus, the right size of the uterus for fertilization, the functioning of the uterus, which side of the what are the different types of uterus, and like when we're talking about as the term of fertility, when we're talking so as a perspective of fertility rehab therapist. So we should know that what type of uterus female is having. We will then understand the fallopian tubes, then we'll understand the ovaries, then we'll understand this fertility, fertilization, and all the process of hormones. And if what is female infertility, what is IVF, and why the IVF are there, what can be the causes of the fallopian tube, what can be the cause of female infertility. And as a physiotherapist, can we do something to create a good functioning of this reproductive system, starting from the ovary, fallopian tubes, uterus, cervix, and the vagina. We will help our females. Okay. That is going to take another 2 to 3 days, actually. So be with me in the journey of reproductive health session. And take care. Bye. Look after yourself.
Bye,
Yes,
ma'am.
ma'am. Bye.
Thank you.
Bye-bye. Good night, ma'am.
Bye. Shushmashu is asking, ma'am, the age can be 55 plus also. Yes, dear. Yes, dear. It can be 55 plus also. How can we check the HPV in males? Same. They have to go for examination. They have to go for this pap smear.
Okay. Thank you so much, ma'am. Good night, ma'am.
Night. Good night, everyone. Bye.
Good night,
Bye-bye.
ma'am. Bye.
1, 2, 3. Bye.
Bye, ma'am.